I'm Sue.
And I'm Steve, and we're aging joyfully.
And here's Sammi. She loves being in our videos, right, Sammi? She doesn't like being left alone downstairs.
No, she was excited to come upstairs and come in the studio, right, Sammi? Look at her. She's so happy.
She came running up the steps. But today we're going to talk about Steve lost his job. It's about a month now. And when he came home and told me, the first thing I said was, we have no insurance. Insurance ends today.
Exactly. It ends the day that you are terminated. And so if you get sick, if you have to go to a hospital, it's on you.
Well, we do know that COBRA is there. So you always have that COBRA option. Now, you get 60 days from the day the paperwork was printed. So we had just over 2 months because it took them about 2 weeks to get the paperwork sent to us. But of course, you heard COBRA, that's so high. Now Steve is able to go on Medicare, and I have been researching it for years because I knew this day would come one day.
Yep.
We were hoping it would be retirement, so we have been looking at Medicare versus Medicare Advantage.
Right. You have to be very careful with choosing your options. Of course, when you turn 65, you have to apply for Medicare Plan A.
But you don't have to. You can stay on your work insurance.
Right. You can stay on your work insurance, but don't you have to register?
No, you don't. We just decided, because it was free insurance, that you would go on Part A. But at the same time, we were no longer eligible for HSA, health savings accounts, that you would put money in tax-free. So we did weigh that for quite a while. And we thought, wow, in the slim chance you have to go to the hospital, we know how expensive those bills are.
Right.
We gave up that tax advantage of HSA for the free Part A. You do not have to go on it if you have work insurance.
So make a correction there. You didn't have to go on it. But you see, this is why it's important to research Medicare, the different options and the different timelines that are involved with it, because you sign up for Medicare and it's not just a one and done kind of thing. There's Part A, B, C, D, E, F, G. So you really have to understand what all the parts are.
And there's an N. But we are not Medicare sellers or experts by any means. It is.
No.
I honestly don't think our government can make it any more complicated than it is already. We both have college degrees, and it's not something you can easily figure out.
It's not easy. There's a lot of reading, a lot of understanding, a lot of scenarios that you kind of have to put yourself in to understand what Medicare is going to pay for, what Medicare is not going to pay for, when is Medicare going to pay, when is Medicare not going to pay, how much do you have to pay before Medicare pays. It's a lot, and it's very, very involving and confusing.
Okay, Part B is the government option, which if you're taking Medicare versus Medicare Advantage, you sign up for that, and it is currently $185, but I heard in January it's going up to $205 and will continually go up forever. Part C is Medicare Advantage, which I believe, and I'm not positive, I believe you still pay that $185, but you don't get that supplemental plan. Part D, I believe, is the Medicare prescriptions or drugs.
Yeah.
And we chose Part G. There's a high deductible or not high deductible. And again, we don't know the future. So it wasn't an easy decision.
No, and it's all very confusing, just like you're probably confused right now from what we were saying, because it really doesn't make sense until you're seeing all of it in front of you and you understand your situation. Part A is the part that you sign up for. That's hospitalization. Part B is for doctor's visits. So Part A is for hospitalization, and it covers part of that.
If you go to the hospital, I believe it covers the cost of the hospital, and we're not positive because it was free. I think there's a deductible. There's 4 different cards now. Steve has 4 cards. And there's 4 different deductibles, or I'm not sure about Part A having a deductible. I don't really know. We're still not clear on that.
Right.
It was free, so of course we
took it. Yeah, I mean it's free. So, and then anyway, there's Part B, which I took, and there's Part G, which I also have, and then there's Part D, which pays for medication. But it's all very confusing as to how much it pays of medication. From what I read, that there's a deductible, that once you pay the deductible, then the medications are free if they're generic, if they're within their list of medications. I just hope that I don't get sick.
Well,
okay?
you will get sick.
At some point,
sick.
eventually,
I
I'm
mean,
sure. Because there's just so much to understand. And then we pay for a supplemental.
Okay, we selected Part G because I wouldn't say it's affordable. It is $163 a month. It could be up to $300 a month. And again, that's going up greatly in January. Now, we did not do the high deductible because I think the deductible was somewhere near $2,700. And I remember thinking when we went to the doctor for just a checkup, you would get a bill, and we normally just looked at our copay of $35. But occasionally I would look at it, and it might be $800 or $1,000 just for a doctor visit. So I got scared that if Steve went twice, you'd have to pay the full doctor bill, which could be $1,000 before it would be free.
Before the insurance kicks in, and so you have to understand all of that. Before you make selections of what plan you wanna go with. So we selected G.
But I did forget that the doctor's visits are not going to be that much because they have to go under Medicare rates, which are significantly lower than the rest of us. The rest of us are carrying the uninsured and the Medicare people.
Right. So we have Plan G, and that's called a supplemental. And so that supplemental you get from somebody else besides the government. You go to an insurance person and you sign up for it, and you make your payments for your Plan G. Now, everything gets run through Medicare first, and whatever Medicare doesn't cover, then your Plan G would cover that. And so it gives you a wider range of doctors that you can go to, because there's also Medicare Advantage where you don't have to go through all these different plans.
Again, we chose G and not the high deductible G. Now, our insurance agent told us that N is similar to G, but it has a little clause that if the place you go felt that there was some charge, I don't know, she said there could be a hidden charge. They felt that they were not being fairly compensated, so they could add a huge charge to your bill. So she didn't recommend N. If you have N, if there's any reason you have N, I mean, if you're super healthy, it doesn't matter what you take because you're not using it. It's when you go to use it that you find out that you don't have the right insurance.
Right. That's the whole problem, and that's why you have to go through different scenarios with yourself and make sure that this fits in all these different scenarios that you really don't know. And it's all very confusing, and you're rolling the dice, and you don't really know until you really need it.
And our insurance agent recommended thinking of yourself at 75 and 80 because you can't switch. Once you get locked into these plans, you can't switch without a physical, and you're not going to pass. So she said if we get that high deductible, we could be locked into that the rest of Steve's life.
Right. Exactly. So, Medicare, you think that, okay, now I'm getting Medicare, government insurance, it's got to be good. Well, don't bank on it, okay? It's going to cost you, and it is going to cover some more things, or you're not going to be paying, but believe me, nobody gives you anything for free. So there is going to be some money that you're going to pay out on a monthly basis, and then when you use the service, when you go to a doctor or you go to a hospital or emergency room or urgent care or get a ride in an ambulance, you're going to be paying okay? And you just really have to read the fine print to understand exactly what you're going to pay in different scenarios.
Well, right now, we're under the impression that it would be less costly than our old insurance. We are paying, well, he's only paying altogether right around under $400, which is more than we were paying for the premiums. But we're under the impression, because the deductible is lower, the multiple deductibles are lower, that if he had a severe incident, that it would be cheaper in the long run. Again, you don't know. And it's being changed all the time. There are 6 different locations that are studying pre-authorization for Medicare, which is what is required with Medicare Advantage. And if that is true, there's really no incentive to get Medicare. Everybody should get Medicare Advantage if you're going to have to get pre-authorization. Because the horror stories that we have heard are that people are denied medical care, or they're denied so long until they die of that condition that that's the big disadvantage of not getting Medicare Advantage, along with if you live in a rural area. As it is right now, only 46% of doctors accept Medicare Advantage, but more and more people are dropping it every day, especially rural areas. And as rural hospitals close, less and less will accept it. And as you travel, you have your list of doctors you can see. So it's a real issue if you have an incident. If you have a heart attack or something, I'm sure they might pay it. They might not. Who knows? You don't know till it happens. So we decided Medicare was safer, even though it is more costly, about double than Medicare Advantage. The Part D, prescriptions or drugs, we chose the zero cost one because Steve can get prescriptions through a big box store that if you have a membership, it's often free or very, very cheap to go that route without using insurance.
Right. And so you really have to look through this carefully, because now Sue is on a different insurance, and we're going to talk about that in the next video. But it's all very confusing. So if you lose a job, you lose your health insurance. You have to get health insurance, because if you've ever gone to urgent care or to a doctor or to a hospital, it can be rather costly, more costly than what you're paying per month for the supplemental and for the Medicare.
And also, Steve could have gone on COBRA. However, when we talked to our agent, she said she wasn't sure, but she thought that when he switched to Medicare, he would then be charged that additional fee. If you don't get on Medicare at 65, you are charged a fee for life if you had no insurance until you needed it.
Right.
Steve had insurance through work. He is over 65. He is 66. She said she thought we would be charged that additional fee for life. She didn't know. We've gotten so many different answers. We talked to a lot of different agents at the time. We couldn't get a clear-cut answer. We couldn't get a clear-cut answer anywhere. We didn't want to take the risk of paying a higher fee for life. Plus, COBRA was actually a lot more than Medicare. So we said there's really no point to be on COBRA. Plus, the deductible is a lot higher. If he had been really sick, I mean, he actually did just about meet the deductible because he had cataract surgery. We kind of regretted that instantly because it would have been a whole lot cheaper under Medicare.
Right.
But who knew? Who knew? You couldn't plan your life and put it off when we didn't know that these things were going to happen. That
Really.
You know, I mean, it was a pretty big shock that he lost his job. I had suspected in the month before he lost his job, once I saw what was in the big beautiful bill, that it was going to impact his position because of the things that were being cut, that businesses have to make money. I have a business degree as well as a master's in business administration. So I know labor is the biggest expense, that's going to be cut when they are forced to absorb other costs that were in the big beautiful bill. But I wasn't aware of what was in it until about a month before he lost his job, a month or 6 weeks. And honestly, I never thought it would go through. I honestly did not think that's something that would take away health care from 17 million. And that doesn't even count us. That doesn't count the people who had jobs. That only counts mostly the Medicaid people, the ACA people. It doesn't count the people who are freshly being laid off. So then that 17 million, it doesn't count all of it. And I knew it would be more than 17 million, but I didn't realize it was going to impact us as quickly as it did.
Right, exactly. So you have to be prepared. If you're not 65 yet, it's a good idea to research Medicare. I know that it's a hard thing to do when you're not 65 because you don't really need it, but you should be prepared for it. And also be prepared if you have a job right now that there's always a possibility, you know, that you can lose your job. I mean, times are tough and they're only getting tougher. So with all the cutbacks, and we're going to see more and more brick and mortar stores that have been around forever closing their doors and people losing their jobs. You know, it's going to come around. If you think you're untouchable, think again, because you're not. And I don't just say that because I lost my job. It's because it's just the way of the world. It's capitalism. It's companies are there to make a profit. And employees is the easiest thing to cut so that the company is making cash flow, revenue minus expenses. And you are an expense, so you are expendable.
Oh, there's so many in our family who could be losing their jobs, nieces and nephews who don't even know they're in jeopardy because they're young and don't really remember 2008. They were young when it happened, and their parents weren't hit as hard as we were in 2008. Steve, along with my one brother who has no children, were hit the hardest with our job losses, but their children don't remember that. You remember 2008, this is what it feels like. Going out in public, it just feels like everybody's so sad and down,
Right.
and it just brings you down. I noticed our last few videos, we've been a lot more down than normally because an old one popped up, and I was like, we were generally pretty happy, but yeah, this weighs on your shoulders when you worry, are you going to become homeless because of health insurance, or are we going to go without health insurance?
Right.
So look out for our next video, and that'll be on what I chose for my health insurance.
Yep.
And wait, and Steve, I did get you something. I ordered something, and this.
Oh my God! Look at this.
Because of the surprise and how down we've been, I ordered from my favorite organization that Sammi volunteers for. Sammi loves to come up here and put on a dress and sit and pose. Just loves it. And you saw one of our videos where she was dancing. Not up here, just after dinner she started dancing. She loves being the center of attention. So she makes cards for Cards of Compassion, and they send these to people who are sad.
That's really nice.
Or they have a birthday.
Yeah.
So we'll show this in another video till we see you again.
Hey, take it easy, and don't forget, subscribe, hit notification, and comment. We're looking for comments. So please comment down below, and we'll see you next time.
And share it with your friends. If they've lost their job, tell them it's not their fault.
Really.
It's not their fault. Look at the jobs report. It is everywhere, sadly.
Yep.
Sadly.
It's tough out there. Stay safe.